Chromophobe RCC shares many characteristics with. Now this is a very simple question, that whenever we talk about chromophobe RCC, the origin of chromophobe RCC, answer is intercalated cells of DCT. So distal convoluted tubule and intercalated cells. And you have to understand that this is a malignancy. This is the malignancy. But there is a similar looking tumor which is known as oncocytoma, which is most common benign tumor of the kidney. This is also having the same origin. So the origin is same. And do you know that this is not malignant, this is a benign lesion. And take my words, it's very difficult to differentiate chromophobe from oncocytoma pre-operatively. Why? Because pre-operative biopsies are not done for RCC, since majority of them are RCC, that is, majority of them are malignant. So renal tumors, we don't do biopsies because majority of the renal tumors are malignant and there is a risk of transperitoneal or a retroperitoneal seeding of the tumor. So it's purely on the clinical features and the radiological findings that we decide we have to go for surgery or no. Now, do you know that chromophobe and oncocytoma, they look alike same? Even though oncocytoma has that classical stellate or a spoke wheel appearance, but still that is not definitive. Do you know it is only on the post-operative biopsy that you can differentiate? So how can you differentiate? Answer is the stain. There is a very important stain which is known as Hale colloidal iron. So there is a stain which is known as Hale colloidal iron, and this is positive for chromophobe and negative for oncocytoma. It's positive for chromophobe or negative for oncocytoma. Along with that, there are some tumor markers also, like cytokeratin 7, claudin, parvalbumin. So they are all of them positive for chromophobe RCC. So the answer for this is oncocytoma.